Dear Krana say and His Excellency John Dramani Mahama or catch a Ghana for you say no cray a baby a chum a binder down na we see a asupiti makumako or ha any edubako and no and a woman to this agenda 111 now was say abra will baby PM it was a bemia so I request some pa and ato no John Dramani Mahama Nina say agenda 111 asupiti and another Kufado Esino Baku Crane why a year juma oh my Ghanaian His Excellency John Dramani Mahama.
Mr. Speaker, the Agenda 111 program, which was started as a knee-jerk reaction during the COVID-19 pandemic, when the Ghanaian public had begun to appreciate the significant investments that the previous NDC administration had made in healthcare facilities, and began to lament the many hospital projects that had stalled under the previous administration, a promise was made to build 111 hospitals. Mr. Speaker, I'm sad to note that there is no dedicated funding source for such a gargantuan project. There is no dedicated funding source for this gargantuan project. Mr. Speaker, for the record, as I speak, not a single Agenda 111 hospital is operational. In any part of Ghana, I challenge you, not one is operational. Mr. Speaker, and it is worth disclosing that $400 million has already been disbursed under the Agenda 111 project. Mr. Speaker, at a rate of approximately $80 million per hospital, this $400 million spent could have completed and made operational at least 22 of those hospitals.
Na I was said na say and His Excellency John Dramani Mahama esan edu to say enchebia ya pomuden ho ensem no we de ehyen bi ba wato din say onuado healthcare na eno no ebeboa amadane dan na yetimi anya ahotoso wo ayarehwem ene enema we de basa de be ebeboa ama asupiti no so no ho etimi ahenha ne kakra His Excellency John Dramani Mahama.
Working with the NHIA will revive the Onuado mobile healthcare vans. These vans will provide OPD, ophthalmology, dental, ENT, cancer screening and care in the remote and most vulnerable communities in our country. An earlier attempt to provide mobile health facilities was abandoned after the change of government in 2017. Mr. Speaker, public health experts are grappling with the conundrum of new diseases and re-emergence of old diseases. The unpredictable nature of disease outbreak suggests we must make our health systems more resilient to shock.
Na e was said to na say and your papa John Dramani Mahama we mu yesuku ntuaso a ye senior high schools no na no wode to yedem say sisia de okopiem free SHS for na so ya aduane papa aduane so de aduane ya wudi na wo ka wotechrema eno ene ade asisia na penso bosumi mienu oba ye emofra no AD His Excellency John Dramani Mahama.
Mr. Speaker, the double track system remains a challenge and we are committed to eliminating it by accelerating school infrastructure expansion and completing stalled educational projects. To fund this, the Education and Finance Ministries are working to uncap the GET fund so that we can accelerate projects in secondary schools. As promised, we have begun improving secondary school feeding, and the children are getting better quality food as I address you. Mr. Speaker, efforts to decentralize school feeding and food management include strengthening procurement and store management records capacity. Once completed, food procurement and management will be fully handed over to the secondary schools to do their own food procurement.
na abra ogyina ne naso bio no na afi yewura ensema okan yemu a wakache Ghana fo nyina se sisi ade enya de obesi asukuu dan biara e wo man Ghana yimu a onfa eye ba bia teacher fo ebeda enka ho na ogyina simpie so no wakache Ghana fo se eya da ne dan nyina se esi dan na ba bia akyerɛkyerɛ fo beda no eni hɔ a eya na aye den e de ama mofra no wodi nsem we to Ghana fo ani.
Mr. Speaker, as part of our Teacher Dabre initiative, the construction of teacher accommodation units to improve welfare and attract teachers to rural areas will commence this year. Mr. Speaker, no new school will be built in this country without teachers' accommodation.
Na abra wo church vendie no so no we eye ensema His Excellency John Dramani Mahama enu a wogina simpie so no wode to Ghana fo anim e wo eye mpempenso a wo man Ghana e wo mu yi na eno wode to aso se ampa obato bibia ye fe ne STEM education ni nyina ne se ekwan mo fa no be fa so na afei abodiem nyansa pa ye besua na afei technology abaso yi so no mo fa no besua bi na afei mfidie hu nwuma ye fe ne engineering no ye besua na afei nkuntabuo a ye mathematics no so no ni nyina ne yetimi asua bi na wase enam se o man bia betu mpon a na da ne da nyina ejina fapima a o man no ebenya e wadesuam ne se enti no wono na pensui sa STEM education no ba bibiara aye 10 regions o man Ghana mu nyina important dunu obi a benya school dan a aye STEM education bi e wo ho.
Science, technology, engineering and mathematics are central to national development. STEM will therefore expand STEM programs at all levels to equip all students for the global economy. We don't believe in building single standalone STEM schools. We believe that STEM must be part of the curriculum of every secondary school. Mr. Speaker, regional TVET centers of excellence will be established to provide practical skills. Every region will get a TVET center of excellence to expand technical and vocational education training. Mr. Speaker, honorable members, Ghana has consistently missed its gross tertiary enrollment targets with a rate below 22%, far from the 40% goal that has been set by 2030. Despite over 460,000 secondary graduates coming out annually, 55% qualify for tertiary education, and only 35%, 161,000 of the 460,000 enroll in tertiary education, leaving over 300,000 without access. To address this, government is introducing a no-fee stress policy to eliminate tertiary admission fees, which currently serve as a barrier to higher education for some students. This will be supported by an enhanced student loan scheme, which is called the Student Loan Plus. The no-fee policy will also cover all persons with disabilities. And for emphasis, persons with disabilities will pay no fees for tertiary education throughout their study.